Good morning, everyone. Today, our group will be presenting our project on physical therapy. We approach this topic from three different angles: research into the history and science of physical therapy, interviews with professionals currently working in the field, and shadowing experiences where we observed physical therapists in action. By combining these perspectives, we hope to give you a clear picture of what physical therapy is, why it matters, and what it looks like in practice. Physical therapy is a healthcare profession that focuses on helping people move better, recover from injuries, and prevent future problems. It's deeply connected to exercise science because it uses biomechanics, physiology, and psychology to improve patient outcomes. Our project goal was to combine research, interviews, and shadowing so we could see the profession from multiple angles. This way, we can understand not just the science behind PT, but also the human side and the day-to-day responsibilities. Physical therapy has a long and fascinating history. It goes all the way back to ancient Greece, where Hippocrates studied muscle therapy and documented its benefits. Similar practices appeared in other cultures, but PT wasn't recognized as a profession until 1887 in Sweden, where physiotherapy was formalized at a gymnastics institute to help athletes recover through manual therapy. In the United States, PT became important during World War I. Women trained as reconstruction aides cared for wounded soldiers using massage and exercise therapy. According to PT Progress, 18 women were trained at Reed College by General William Gorgas to administer therapy to injured troops. Mary Macmillan later became the head of the first PT department at Walter Reed Hospital and founded the American Women's Physical Therapy Association in 1921, which eventually became the American Physical Therapy Association. This history shows how PT grew from ancient practices into a formal science-based profession that is now essential in healthcare worldwide. Today, physical therapy is recognized as a vital part of healthcare. PTS focus on three main areas: treatment planning and diagnostics, education and prevention of injuries, and therapeutic rehabilitation exercises. The Cleveland Clinic explains that PTs are often part of a patient's care team alongside doctors, helping people recover from injuries, surgeries, or chronic conditions. They use evidence-based practices, meaning their treatments are backed by scientific research. Modern PT isn't just about recovery. It's also about prevention. PTS educate patients on how to avoid future injuries, improve posture, and strengthen weak areas. They use tools like goniometers to measure joint angles, resistance bands, weights, and specialized equipment to track progress. The impact of PT is huge. It improves mobility, reduces pain, rebuilds strength, and helps patients return to daily life or sports safely. We interviewed Eric Avers, a physical therapist here at BGSU. He described his typical day, which runs from 7:30 in the morning until 6 at night. He starts with about 45 minutes of planning and scheduling, then spends most of his day in direct patient care. He also has administrative duties and supervises athletic trainers to make sure they're doing their jobs correctly. His responsibilities don't change much depending on the patient. He always has to assess what someone can and can't do safely, especially in the weight room. Eric's career path is interesting. He started out as a pre-med student, planning to become an orthopedic surgeon, but he realized he preferred the lifestyle and working hours of physical therapy. He switched to PT and athletic training and eventually specialized in sports injuries. He's done research on ACL tears, labrum injuries, Achilles tendon problems, and bone stress injuries. This shows how PTS can specialize in many areas: sports, pediatrics, geriatrics, neurology, or orthopedics, depending on their interests and experiences. Eric emphasized that while technical skills are important, personal skills matter even more. You have to communicate clearly, build connections with patients, and be willing to ask questions when you're confused. Early in his career, he was afraid to ask questions because he didn't want to look dumb. But once he started communicating with doctors, coaches, and other PTs, he grew much faster. He also stressed the importance of building rapport with patients. If patients feel respected and supported, they're more likely to stay motivated and recover successfully. PTS need empathy, patience, and adaptability. The most rewarding part of PT, according to Eric, is seeing athletes return to the sport they love, or patients regain independence in daily life. But the hardest part is working with patients who aren't motivated. If they don't put in the effort, recovery slows down. PTS also have to balance research evidence with real-world needs. Sometimes research doesn't support a treatment, but the PT knows from experience that it works. In those cases, they have to justify their decisions to insurance companies. Eric gave us advice for students interested in PT. First, get as many observation hours as possible in different settings. Even if you want to specialize in sports, don't ignore other areas: pediatrics, geriatrics, neuro. PT school is competitive, and diverse experiences make you stand. Out! Once you're in PT school, get hands-on experience. He also stressed the importance of setting boundaries and balancing work and life. Because the job can be demanding, Brandon shadowed at the Lyle Torrance Center in Michigan, which serves students with developmental disabilities from birth to age 26. Unlike a traditional PT clinic with gyms and private treatment rooms, this was a classroom-based environment. Students were brought into private rooms where a physical therapist and an assistive technology professional worked together. The PT focused on evaluating how the student moved, their balance, gait, flexibility, and strength. The ATP acted as the equipment expert, suggesting mobility devices and taking measurements to ensure proper fit. Together, they recommended equipment, like custom wheelchairs, specialized walkers, standing devices, and adaptive strollers for younger children. One striking observation was the sheer number of specialists involved. Sometimes 6 or 7 professionals collaborated on a single student's case. This teamwork highlighted how complex it can be to support patients with multiple needs. Brandon also noticed the heavy documentation required. Insurance companies demand detailed reports before funding specialized equipment, so PTs and ATPs asked many questions about the student's daily environment and relied on parent and teacher input. A memorable case was Zach, an 18-year-old with cerebral palsy affecting his legs. He had previously undergone hip surgery with a metal plate, which limited his hip movement. The PT asked him to walk across the room to evaluate his gait, then measured his hip flexion with a goniometer. Zach expressed interest in getting an arm bike so he could join bike rides outdoors, and the PT provided resources to explore that option. Ultimately, they determined he needed a custom wheelchair seat to accommodate his hip condition. Brandon's biggest takeaway was how PTS must problem-solve creatively. With hundreds of equipment options available, they narrowed choices through careful observation and elimination. He also saw how PTS adapt communication styles for students with cognitive or communication disabilities, often relying on parent and teacher input when the student couldn't follow instructions. This experience showed that PT is not just about exercises. It's about teamwork, problem-solving, and individualized care. Dominic's shadowing took place at PT Services Rehabilitation Clinic in Fremont, Ohio, with Dr. Ally Deacon, a recent graduate of the University of Toledo. She primarily works with pediatric patients, but also treats adults, and she mentioned she will soon begin teaching in the PT program at Toledo University. The first patient I observed was a woman in her 40s to 50s with a torn rotator cuff. Dr. Deacon had her lie on her back, holding a 1-pound dumbbell in an elevated position. She instructed the patient to write the alphabet in the air with the dumbbell. This exercise targeted range of motion, strength, and motor control. Afterward, the patient performed front and side lateral raises to further strengthen the shoulder. Finally, a heat pad was applied for 10 minutes to relax the muscles before scheduling her next appointment. This case showed me how PTS use simple but creative exercises to restore function in injured joints. The second patient was a 6-year-old boy with cerebral palsy. His therapy focused on walking independently and improving balance. To motivate him, his mother held Play-Doh, encouraging him to walk toward her, while Dr. Deacon supported him. They repeated this exercise in both small and larger rooms to gradually increase walking distance. For balance training, the boy stood while Dr. Deacon distracted him by showing different colors of Play-Doh. He managed to balance for 55 seconds, a big achievement for him, To reduce his fear of falling, a crash pad was placed behind him. Interestingly, he began falling backward on purpose because he thought it was fun, which showed how PTS must adapt to unexpected behaviors. Later, he practiced climbing stairs, motivated by ringing a bell at the top and bottom. This exercise was crucial for real-world mobility. The third patient was a man recovering from ACL surgery just 3 days earlier. Dr. Deacon conducted an initial evaluation, asking about pain levels, mobility, sleeping arrangements, and medications. She removed the surgical wrapping, inspected the incisions, and measured his range of motion with a goniometer. She then discussed his work responsibilities and physical expectations to tailor his rehab plan. The plan included a home exercise program and clinic visits twice a week for the first few weeks. This case highlighted how PTS combined medical knowledge with practical planning to help patients safely return to daily life. What stood out to me across all 3 cases was how Dr. Deacon balanced technical skills with creativity and empathy. She used motivators like Play-Doh and bells for children, applied heat therapy for pain relief, and carefully measured progress with tools like goniometers. She also adapted exercises to each patient's unique needs, whether it was a child with cerebral palsy or an adult recovering from surgery. This shadowing experience showed me the diversity of PT practice and the importance of patience, adaptability, and individualized care. When we combine the research, the interview, and the shadowing experiences, we see a complete picture of physical therapy. The research gave us the historical foundation and explained how PT became a science-based profession. The interview with Eric Avers gave us professional insights into the daily life of a PT, the skills required, and the challenges they face. The shadowing experiences showed us what PT looks like in practice. From equipment evaluations for students with disabilities to hands-on therapy for patients recovering from injuries. Across all 3 perspectives, the same themes appear. PT is patient-centered, collaborative, evidence-based, and requires adaptability. It's about more than exercises. It's about communication, motivation, and problem-solving. Looking ahead, physical therapy will only grow in importance. With an aging population, rising sports injuries, and chronic conditions like arthritis, demand for PTS is increasing. New technologies are also changing the field. Telehealth allows PTs to guide patients remotely. Robotics and exoskeletons are being developed to help patients relearn walking. Artificial intelligence is being used to track progress and personalize exercise plans. PTs are also becoming more integrated into interdisciplinary healthcare teams, working alongside doctors, nurses, and occupational therapists to provide holistic care. The future of PT is exciting, with more opportunities to improve patient outcomes. In conclusion, physical therapy is a rewarding, science-based career that requires empathy, adaptability, and dedication. It takes about 7 years of education, including a Doctor of Physical Therapy program, but the impact on patients' lives makes it worthwhile. Our project gave us a deeper appreciation for PT. We saw how it evolved historically, what it looks like professionally, and how it plays out in real-world settings. Whether it's helping a child with cerebral palsy take steps, guiding an athlete back to their sport, or supporting someone after surgery, PTS make a real difference. This project showed us that PT is not just about exercises. It's about resilience, creativity, and patient-centered care.